Thank you for tuning in to learn about COVID-19 vaccines for children 5 to 11 years old. I am Dr. Noel, and joining me is Deb Gortowski. We are providers at KSB Pediatric Clinic. We will be answering some of the common questions we have found about the vaccine for 5 to 11-year-olds. In the description of the presentation at the bottom, we have the link to the presentation we did earlier this year on COVID-19 vaccines for the elder children 12 to 18 years old. So let's get right into it. Deb, what is the recommendation for the ages of children to get the COVID-19 vaccine?
So the CDC is recommending everyone age 5 and older get the vaccine to protect against COVID-19. The doses for kids are divided into the 5 and 11 age group and the 12 to 17-year-old age group. Pfizer is the only company with approval for administering the COVID vaccine in these age groups.
And how is this vaccine different from the 12 plus vaccine?
So the COVID-19 vaccine trials with children looked at different doses to find the safest dose that gave the best immune response. And the Pfizer BioNTech COVID-19 vaccine for children 5 through 11 is administered in 2 doses, 3 weeks apart, and is given as a lower dose of 10 micrograms. And the 12 to 17-year-olds receive a 30 microgram dose. So why do young children need to be vaccinated?
Well, generally, kids are at a lower risk of becoming severely ill from COVID compared to adults. However, they can still get very sick and die. Up to now, approximately 2 million kids have gotten COVID. They still could get hospitalized. One thing we've noticed is the syndrome, the multi-inflammatory syndrome, MIS-C, is much more common in this age group compared to any other age group. Kids could also suffer from long-haul COVID, and this decreases in-person school attendance, which we know is very important. So all in all, to prevent all the above conditions, getting them back to being in school and also preventing transmission to other age groups is a big deal. So we really need to get our young kids vaccinated.
So how do we know the vaccines are safe and effective?
The COVID vaccine has been extensively monitored, and we have looked a lot at the vaccine safety, and it's been extensively studied, and we have seen no serious side effects in this age group. It's very effective. It shows almost 91% effectivity in preventing COVID-19 in this age group. So, what are the common side effects from the vaccine for kids this age?
So most kids complain of a sore arm, and there's usually a little redness at the vaccine site. The other complaints were fatigue, headache, and muscle pain. And these side effects happened 1 or 2 days after the vaccination and lasted for a day or two. They were very mild to moderate. The younger kids complained less of chills and fever than the older children did. So, Dr. Noel, when is a child considered fully vaccinated?
They are considered fully vaccinated 2 weeks after the second dose. So when the child receives the first dose of the vaccine, we recommend scheduling the second dose at the same time so you're right on schedule.
Okay.
Will all children ages 5 to 11 be eligible to receive this vaccine, Deb?
Yes, the vaccine's available for all children in this age range, regardless of their medical history. So there are children who are going to turn 12 very shortly. They're 11 now, and they're going to turn 12. Which COVID-19 vaccine should they get, or should they wait?
So we recommend that they get the vaccine that is recommended for their age and not waiting. It's important to understand that the lower dosage for the 5 to 11-year age group is just as robust, and we expect a very high immune response like the older kids with less side effects.
What about children who are 11 and get their first dose and then 3 weeks later turn 12 years old?
Good question, Deb. Um, and just as I said before, we strongly recommend you get the vaccine that's recommended for the age. So at 11, they'll get the 11-year dosage, and at 12, they will get a 12-year dosage. Can it be given with the child's other scheduled vaccines?
Yes, co-administration is very safe. We want the children to get their scheduled vaccines, and the COVID and also the flu vaccine can be given at the same time.
Okay.
So if children have already had the COVID-19 illness, do they need the COVID-19 vaccine?
Yes, they do. The vaccine will help protect children from getting COVID-19 again, especially with the variants we have around, like the Delta variant. In addition to being fully vaccinated, this will help them getting serious illnesses or being hospitalized. You must call your healthcare office just to know the guidelines. For example, they could get the vaccine probably after 10 days of being in quarantine, or after having the monoclonal antibodies, it's 90 days. So you really need to touch base with your healthcare provider. Studies have shown that the best protection against COVID-19 is active infection plus the vaccine. So, yes, we do recommend that they get the vaccine. So, with all that being said, for more information, we recommend that you check the following reliable websites. It would be attached to our presentation today: the cdc.gov website and the healthychildren.org website. Thank you for tuning in.
Thank you.